What?
No.
No, I didn't know that.
I had absolutely no idea about that.
Makes me feel pretty frustrated.
I would have thought up here in the Territory it would have been legal. I'm actually from Western Australia, where it is legal.
I guess if I was ever in a situation where something, if I'd been raped or whatever, something bad like that had happened to me, it would probably make me feel pretty angry that I couldn't then access those services.
And I would have thought in the Northern Territory, the great libertarian north of this fine country, people would have had the right to choose what happens to their body.
That would probably make me pretty angry and frustrated, that knowing that only in this territory in the whole country, that it's the only place where I can get it done.
Yeah, that's crazy. It's a really backward policy. Like we were in the 1800s in England, Catholic Church rule. Everyone has the right to decide what should happen to themselves, whether they're male or whether they're female.
Hi, I'm Anne Nicholson and I'm on board On Her Terms.
Hi, I'm Sarah Brown and I'm on board with the On Her Terms campaign.
Hi, I'm Karen Keefe and I'm on board with On Her Terms.
I work in public health as a researcher, and learning about the Northern Territory Medical Services Act really surprised me. It's an issue where there are huge problems with health equity.
I worked in San Francisco, California. It was a family planning clinic, and I also worked as a volunteer at Women's Choice Clinic in Oakland. These are clinics that provided medical terminations.
U486 has been available in countries around the world for the past 20 years. It's on the World Health Organization's list of essential medicines, which means that they're medicines that they recommend are available to all women wherever possible because they're safe and effective medicines.
I worked with a variety of women and families, and they came from all different backgrounds.
The statistics in the Northern Territory at the moment are that 1,000 pregnancies are terminated annually. With those 1,000 pregnancies comes 1,000 different reasons for terminating.
I've been working in the Territory for the last few years. I have come across women of all ages, specifically women who come from areas outside of Darwin.
I've seen how long surgery waitlist times can be. I've seen how difficult it is to get to Alice Springs and Darwin for important surgeries that need to happen.
So having worked in an area where medical termination was legal, and in the areas where it was legal, women have faced certain challenges. Then to come here in the NT, where medical termination is not legal, and suddenly the challenges are tenfold.
Something as personal and as emotive as deciding to terminate a pregnancy, it's never an easy choice.
There's good evidence that where women have access to safe and effective termination of pregnancy services, they access these services far earlier on in the pregnancy, and this reduces any risk of complications.
I believe that every woman should have the right to make decisions about her body in her way, on her terms.
Healthcare services are about evidence-based medicine, not personal beliefs. And there's good evidence to support the use of RU486.